Hello, this is Dr. Grande. Today's question is, what is depersonalization derealization disorder? I'm going to refer to this disorder as DDD. And with this disorder, we see criteria that has a dissociative property, as well as some other criteria. Now, the classification for DDD is in the Diagnostic and Statistical Manual, the DSM. And we see with the symptom criteria that somebody would have to have a depersonalization experience or a derealization experience, or both. So with depersonalization, this would be experiencing detachment, unreality, feeling like you're an outside observer to your own body, thoughts, actions, feelings. So this would be a distorted sense of self, perceptual distortions, or emotional or physical numbing. Now, derealization is similar, but it's an experience of detachment or unreality related to surroundings. So experiencing other people or objects in a dreamlike, foggy, or visually distorted or unreal way. So they're similar, but that distinction is really whether the symptoms, the unreality and detachment, are about the person or about the surroundings. It's not unusual, of course, for both types of experiences to be present when there's a diagnosis of DDD. Now, there are other criteria for this disorder, including that reality testing is intact during the experiences. So the first thing we might think of when we hear about depersonalization and derealization is psychosis, but it's not the same thing as psychosis. An individual with depersonalization and derealization can separate reality from fantasy throughout the entire experience. With psychosis, of course, that would not be the case. Other criteria include there is clinically significant distress, and this would be in areas of social, occupational, or other functioning, and the experiences are not attributable to substances, a medical condition, or better explained by another mental health disorder, like schizophrenia, major depressive disorder, panic disorder, or post-traumatic stress disorder, for example. So the experiences here, the dissociative experiences that we see in DDD, can last hours, days, weeks, months, and sometimes even years. So it's highly variable in terms of how long the symptoms can be present. Some common descriptions we hear with this disorder on the depersonalization side would be an out-of-body experience, feeling robotic, lacking control over movement or thought or feeling, and also knowing that feelings should be present but being unable to feel. With derealization, some of the common descriptions are looking at the environment and it feels artificial, lifeless, or colorless, and also visual distortions and auditory distortions are common with derealization, in particular visual distortions. Now, these experiences, depersonalization and derealization, are actually quite common. Most people will experience this type of dissociative event at some point in their life, but only about 2% of individuals will meet the full criteria for this disorder. DDD affects males and females at the same rate and typically has an early onset. We think of this disorder as having an early onset compared to a number of other disorders. The mean age, the average age of onset, is 16, and an onset of DDD after the age of 20 would only occur about 20% of the time, and after age 25, only about 5% of the time. There are a number of mental health disorders that co-occur with DDD. We call these comorbid. We see major depressive disorder. All of the anxiety disorders are comorbid with DDD. Avoidant personality disorder, obsessive-compulsive personality disorder, and borderline personality disorder are fairly common comorbid mental health disorders with DDD. Now, post-traumatic stress disorder is actually not highly comorbid with this disorder. So what causes DDD? Well, there are a number of theories. We believe that trauma, abuse, neglect play a part, particularly if they occur early in life. We also believe that fatigue, stress, and anxiety can bring about the experiences seen in DDD. So we're really not sure of the genetic contribution versus the environmental, the heritability versus environmentability, but we have identified some of those stressors as being tied to the presence of DDD. Now, DDD is sometimes confused with dissociative identity disorder, and probably because they're both dissociative disorders, and if you look at the acronym DDD compared to DID, they're fairly similar. I think another reason these disorders tend to get confused is because in the symptom criteria for dissociative identity disorder, we see depersonalization and derealization. So the exact same terms are used in the symptom criteria of both disorders. However, they are separate disorders. I hope you found this description of depersonalization, derealization disorder to be interesting. Thanks for watching.